And read that compliance related concepts. I given domain 4 and 5. The multiple choice questions also, no? Total 90 questions we have from domain 4 and 5. If you roughly go through that questions, you will understand the concept and it will be easy. So today we can discuss about multiple provider queries. So first question, multiple choice queries must supply how many choices to be complaint? How many options we need to give while we are raising the multiple choice query?
No specific number.
No specific number.
There is no specific number to give the multiple choice options. Okay, well, there is no specific number. Second question. Complaint queries includes which of the following? While you are raising the query, complaint query, what you need to includes in that?
Relevant clinical indicator.
Relevant clinical indicators.
Clinical indicators we need to provide. Next check, this is a complaint query or not. If it should be complaint, why? Read the question and check it should be a complaint query or not.
Yes, this is the complaint query.
Yes, it is the consent query because the indicators needed.
X-ray and lungs.
It was a complaint query. Okay? Because they not mention anywhere diagnosis. Coding professional raise the query like this. From here, all the options they given. A coding professional raise the query as because clinical indicators are being provided without leading a diagnosis. It should be a complaint query. Fourth one, it was a complaint or not.
No, not a complaint query.
No,
Not
it is
compliant.
not.
It's not a complaint query. Okay? No, it's not a complaint query. The query was leading, but they mentioned possible
Possible.
in the question. Fifth question, based on the indicators, which condition we can raise the query?
Acute congestive heart failure.
Heart failure.
Congestive heart failure, right? Like ejection fraction,
Lasix
Lasix, all are the
Lasix medicine.
treatment of congestive heart failure. Next, which of the following make a query complaint? What we need to raise a complaint query?
Providing a concise
Providing-
presentation of facts and clinical indicators. Option B.
Option
B.
providing concise presentation of clinical indicators. While we are raising the query, clinical indicators we must document. Okay, the clinical indicator should be main while you are raising a query. Seventh question. They raise the query like this and they asking it is a valid, is this valid query, why or why not? From here, so document the coding professional created the query like this.
Yes, valid. Query.
Valid.
We show the options. First one, no, the title query is leading. Yes, the relevant clinical indicators are presented. No, there are not enough multiple choice answers. Yes, the provider has to option to document the other. What
The
is the
relevant
answer?
clinical indicators are presented.
Relevant clinical indicators are presented. So first thing is, this is not a valid query.
Leading. The title is leading.
Leading. Okay, answer A correct. Because here they put leading query title. Directly they are mentioning acute blood loss anemia. Again they raised in non-leading. Both versions they raised. Acute blood loss anemia they created for that. Again they raised multiple options. While you are confirming a diagnosis, again why you are giving the options. We need to lead either leading or non-leading version. They put the title leading, again they raised in the non-leading version. Okay. No, the title query is wrong. Next. 8th question. Check.
Weeks of gestation and pregnancy.
Week of gestation and trimesters.
Weeks of gestation. Because here they given the unspecified weeks. While we are coding the pregnancy document, weeks of gestation must need, guys. Why? Because now, without weeks of gestation, we don't know for which condition we need to raise the document. Okay. Weeks of gestation need. Okay. Weeks of gestation or trimester. Next. Next question. Check 9th question. They are asking POA. For POA, we can raise yes or no query or not.
Option C.
Option C.
C.
Yes or no query may be used for the established POA status. Yes or no query is not preferred for all queries. Okay, for POA we can use. All formats not use the yes or no query. Okay, all formats not useful. For POA we can use yes or no. Next question, indicators representing for bronchiolitis. Okay, this runny nose, positive RSV test. These all are bronchiolitis indicators. Okay, bronchiolitis, wheezing and all. Next question. Following a vertebroplasty for fracture of thoracic tendon, the patient developed cement embolism. From this information, can a coding professional verify a complication occurred or not? Can we verify it was a complication occurred or not? First, yes or no, you can check.
The cement Decimal code itself consider the complication code D.
Answer
D.
B. Yes, code first note instructions uses a complication code with the cement implemented. So we need to check which code we need to first. Okay, we have the code first concept here.
సార్ ఇక్కడ ఆప్షన్ బినా సార్ 11th
Yes,
క్వశ్చన్
yes, B and it was a complication, but we need to check code first. Okay, which one we need to code, fracture or comp? Next, second, 12th one. When a complaint query remains unanswered, what is the next step for the coding professional? You raise the query, but there is no reply.
డేస్ సార్
C. So refer the internal escalation policy and follow the process outlined. Okay, if you are not getting the answer for query, we need to check our office internal escalation policy. What we need to do. So we should not report to the direct patient or him or CEO. Okay, we need to refer our internal escalation policies and we need to follow that. Thirteenth one. Here, after the post-operative, will develop a post-operative ileus after the surgery. NASA opted for after resolution of the ileus. What is the query opportunity here?
Option D.
Option D.
ఆప్షన్
It
డి
was a post-operative complication or not, we need to check. Due to the surgery developed or not, we need to check. Fourteenth question, what is the true about verbal queries?
Number B.
Option B, sir.
రైటింగ్ ద రిటర్న్ రైట్
Written response.
రెస్పాన్స్
Option
B.
B. There must be response in the written. If you write the query also, they will give the response in written compulsory. Fifteen. Lisinopril and blood pressure.
Option B.
Does the patient have hypertension? Does the patient have hypertension or not? We need to check. 16th.
సబ్మిటెడ్ నైట్
So urosepsis means can you consider as sepsis?
No.
Okay, there is no specific code for the urosepsis and we should not consider as sepsis. So option A should be wrong. Okay, well? Next. Yes, because the provider can answer the negative and supply further. No. No, because the question is leading to provide a
Option.
specific diagnosis, making non-complaint. No, because no other
Ye-
option besides sepsis is offered. At least 3 options must be given to the complaint. Yes or no, no, it was a complaint or not? We need to raise in complaint version or non-complaint version, tell me. Based on the indicators.
Complaint was.
Why you need to use complaint version? Based on the indicators, we need to raise the query. The coding professional queried urosepsis means sepsis. They're asking like this. This is a complaint query.
No, this is a leading query.
Leading, right? Non-complaint, no?
Non-compliant.
C. Directly they mention the diagnosis, right? Urosepsis means sepsis. How it should be complaint version then? It should be making in non-complaint, correct? Lead the no, because the question is leading to the provider to specific diagnosis, making it non-complaint. They directly given the sepsis, so it should be non-complaint version. Clear, right?
Yes, sir.
Next check 17th question. Hmm. C. Yes, information from a previous health record can be used by the specificity of conditioners, guys. Specificity we can take anywhere in the record. From here we can consider for CKD stage 3. No need to raise the query. Specificity we can take anywhere in the document. Okay, we can go with option C. 18th. We can go with excisional or we can go with non-excisional or query. There is no type of typed operative report and no pathology report. What should be the coding? There is no typed. They not mention anywhere excisional or non-excisional and depth also. Okay. We need depth and type of the debridement. Okay. While we are coding, we need type and depth of the debridement. Okay. So query the healthcare provider who performed the procedure to determine if the debridement was excisional or non-excisional. Okay. We need to raise the query, guys, if they not mention the type and the depth of the debridement. Okay, but do not code directly without type and depth. Nineteenth. What should be coding professional do when creating complaint queries?
Option C.
Query once with additional follow-up if necessary. That's it. Okay. We need to raise the query once, and if there is any additional follow-up if necessary, we need to raise the additional follow-up. Okay. 20. So option
A.
D. Okay. Because we should not code the COPD from the radiology report, right?
Yes.
Hmm.
So any conflict between path and attending physician report should be a yes and no query?
Yes, or no query
Always?
only, no. Because you can get the result in two options, right? It was correct or wrong, we need, that's it, right? Whatever the
Okay.
pathology report documented, you need to code or not, yes or no, that's enough, no? Pathology,
Okay, so any
cause and effective
so any
relation.
conflicting documentation would go with yes or no query type in
Yes, correct.
okay.
See,
Okay.
conflict between the two providers, okay?
Yes.
And POA status,
POA,
laterality,
cause and effect. Yes.
laterality type also we can raise in the yes or no.
Cause and effect?
Laterality queries, right or left, what we need to take, that also you need to raise in yes or no.
Yes or no.
Next, 21.
Option A.
Option
Option A.
A.
Yes, sir.
Yes. Bone graft used or not. When the documented fusion, we need to check bone graft or fixation device what they used. So here, bone graft used or not, we need to check. Because it was a fusion. Okay. For this procedure, bone graft they used or not, we need to check. Next. 22 question.
Septic shock.
Query for the septic shock. Okay, septic shock because guys, patient have extreme low blood pressure, which means circulatory failure, and patient was on vasopressors, okay, antibiotics. So these all are related to the septic shock indicators. Up to this sepsis, Okay, this fever, chills, tachycardia, respiratory relation, these all are chills. And pneumonia also diagnosed and they admitted to ICU. Antibiotics given along with vasopressors. When they given vasopressors, it should be go with septic shock. Okay.
Sir, I have a doubt in this question. Why can it not be option C, Staph aureus pneumonia, because antibiotics are also being given?
These all are the indicators supporting for the sepsis, right? Fever, chills, tachycardia,
Yes.
lactic acidosis. So we based on one indicator, we should not go for the organism. No, they need to take at least blood culture, right?
Okay. Okay.
Third.
Option A. Because of retinopathy.
Option A. The documented retinopathy only. They not mentioned right or left or bilateral. Okay. Which side they performed procedure, they not mentioned. So we need to go with specificity query. Option A, whether right or left or bilateral eyes, which side they performed. Next, which of the following is true about complaint multiple choice query? While you are raising a
Option C.
complaint multiple choice query, what is the correct one? They must contain every possible option for the provider to choose. They can provide a new diagnosis with supporting clinical indicators. They should provide a minimum of 3 options. They are the preferred query format for establishing POA. POA we can raise in multiple choice. POA status can we raise in multiple choice or not?
Yes, sir.
POA yes or no, right? So this one wrong. Then we have
No question.
C, sir.
this also wrong. This CD wrong. Now check AB. Because POA yes or no, so it should be not prefer the multiple choice. There is no minimum option for 3 or 2. There is no option minimum option for the multiple choice. Yeah. Answer should be B. They can provide a new diagnosis with supporting clinical indicators. Option B.
Option B, if we are choosing means that way is going to leading query.
That is,
If we choose option B, then that one is going to be leading query. No?
yeah, we can raise leading also in multiple choice version,
If
right?
we are provided the diagnosis
Whatever in multiple
as
choice,
per
we
the
need to raise
question
either leading or
complaint,
non-leading version. They're asking not complaint query, which is true about complaint multiple choice queries. While you are complaint a multiple choice query, what is the correct? While you are raising a complaint query, you will give the diagnosis or not? Tell me first thing. While you are raising a complaint query, you will give the diagnosis to provider or not?
Yes.
We can give or not?
No, ಇಲ್ಲ
We should not give, right?
ಯಾಕೆ ಆಲ್ರೆಡಿ ಗೊತ್ತು ನನಗೆ ಅವ್ರು ಗೊತ್ತಿರೋದೇ ಹೇಳ್ತಿದ್ದಾರೆ
So, we should not give the
no, not here.
option. Condition name we should not mention in the complaint query, correct? Yes or no, guys?
We can give options.
We should not mention the condition name directly, right?
Yes.
So which condition we don't know. So they can provide a new diagnosis with supporting. The provider will give the diagnosis based on the supporting data. Whatever options you provided in that they will give, or other diagnosis they will give. We don't know the diagnosis. That's why it should be a correct new diagnosis. We don't know what diagnosis. That should be the new diagnosis.
Okay.
25th question. Ji.
Option C, other must be included.
Option 1. Acute and chronic CNS.
Which one is correct? While you are raising the multiple choice query, make any complaint query in the multiple choice option. Any option missing or these 4 options enough.
Option
We need to
C.
give
Option
other
C.
option must be included. Okay, while you are raising the multiple choice query, other option you need to give must. Okay, option C.
Sir, can you explain once again?
Simple. While you are raising the multiple choice query, while you are providing the multiple options, along with that options, other option we need to add. Whatever you are thought the diagnosis, you need to add. And other option at last. ఇవి కాకపోతే ఇంకేంటో నువ్వు రాయి అన్నట్టు other option we need to give. Okay. While you are raising a multiple choice query, give the other option at ending. Whatever the options you are providing, provide, and other option you can give at ending. Twenty-six. Identifying the following query is a complaint and the appropriate rationale. Dr. Jones, you state the patient has CHF in your discharge summary. Can you please indicate which type of CHF the patient has? They given these options, acute and chronic and other. This is a complaint query version or not?
Non-complaint.
Which one is correct?
This is the non-complaint query, right, sir?
Yeah, it was not a complaint query. But if you make the complaint, what you need to provide? It is not a complaint query. Okay, no, this is not a complaint query. This is leading to the patient. More reasonable choices should have been provided. We need to give more options if you raise in a multiple choice. Here they given only acute and chronic, right? Acute and chronic. We don't know which acute and chronic, either systolic or diastolic. Need to give them more options. Systolic acute and chronic or diastolic acute and chronic or combined systolic and diastolic acute and chronic. Only acute and chronic means what type of acute and chronic? We have different types of heart failures now. While you are raising the query, you need to give all the reasonable options in multiple choice version. It should be leading to the directly leading. Okay, it's not a complaint query. Directly leading. While you are giving the complaint, you need to give multiple options. Okay, it not stop with one option. So it should be more options we need to provide. It was not a complaint query. It was a leading. 27, leave it. 28, tell me.
Option C, wrong provider.
Option C, wrong provider. Because here they are raising the query to consulting pulmonologist Dr. Reynolds. Dr. Reynolds should be the consulting provider, right? We should not raise the query to Dr. Reynolds. A consulting provider, we should not raise. We need to raise the attending patient for Dr. Hawkins. Okay. So it was addressed to the wrong provider. Got it?
Yes.
21 based on the antiretroviral therapy, it should be HIV, correct?
Yes. Carcinoma.
Yes.
Pepsi carcinoma.
Next 30 question. Cephalic presentation means cephalopelvic dysfunction. Okay.
సార్ ఎగ్జామ్ లో క్వశ్చన్స్ ఈ టైప్ లో ఇస్తారా సార్?
అవునండి, ఇవే రావి టైప్ లో వస్తాయి.
Eclampsia.
Hello. If you understand these 30 questions, in this type only you will get, okay? Complaint, how to raise, yes or no type, multiple choice, leading version, like this only will get the questions. Clinical indicators related and all. Okay. So go through these queries, guys. Next, come to the domain 4. I given the domain for some PDFs, right? 4 and 5. In that we have
Yes,
some
sir.
questions also, no? We have some questions,
sir.
right? In that.
Yes, sir.
So read that also. So one concept we can discuss now. Domains related. It was completely theory. If you read also, you can understand, okay? First concept, note down, computer assisted coding. CAC. It was in the domain 5, you have the concept CAC software. Computer assisted coding. Computer assisted coding, CAC software, and it was impact on the coding. In this CAC software, you will get 2 to 3 questions. So simple CAC means automation, AI, okay? Previous days, what will happen? No? You will get the documentation and software. We need to review the document and we need to code the conditions. Okay, it was happening olden days. Now what will happen after implementation of artificial intelligence? The software was reading the documentation how humans are reading, and it analyze the document and it will provide the codes and procedure, diagnosis codes and procedure. Auto suggested process was going. Read these first lines, 2 lines. What is the CAC? These 2 lines you can read and tell me your understand. What they are saying? Computer auto-assisted is a software tool that uses natural language processing and machine learning to analyze clinical documentation and suggested appropriate medical codes for the patient records. Correct? Either diagnosis or procedures it will suggest. Okay, how we are reading the document? The software also read. So software uses which language? The software uses NLP.
NLP.
natural language processing. This language they are using. Okay, and it was analyzing the coded data. And it was not coding directly, guys. It will suggest the codes. Okay, for patient record. It won't code, it will suggest the codes for us. You will get the document and suggested codes, auto suggested. Because now the software will not code complete 100% accuracy, right? That's why it was not coding, it was just suggesting as of now. Okay. So what are the codes it was suggested? The coder cross check it was correct or wrong. If the diagnosis what suggested correct means we can accept, it was not correct, we can reject. If the software any diagnosis missed, we need to add additionally. If the that's it. Okay. This work going as of now. This software was suggesting actually 80 to 90% of the accuracy coding. Okay, not 100%, but we will get 80 to 90% of the accuracy. For remaining 20% accuracy, the coder was working on it. Okay, a lot of coding projects already going automation. Okay. So next thing, if you get the auto suggested, what is the impact on coders? How it will be impact on the medical coders? If you get auto suggest automation any work, what is the impact on the humans or coders?
Verify that
Hmm?
one is correct or not.
I didn't get you.
Suppose the code is registered means you need to check that one is correct or not.
I understood how it will be impact on the coder. I am asking. Suppose if one project you are doing, it was done automation, how it will be impact on you?
Employee
numbers.
Whatever you are going to do work, okay, whatever you are currently doing work, it was done automation. How it will be impact on you?
Employee number.
reduce the manual.
Reduce the manpower, correct? Increase the productivity and reduce the manpower, correct? Yes or no, guys? If automation already software was doing the work, why we need to hire you? So first impact should be on medical coder, increase the productivity. They will increase the number of charts coded per day. Actually, who are working in the same project, previous non-code or not non-auto suggested, after implementation of this CAC software, 30% of the productivity they increased. Who done 100 charts, now they are doing 130 charts easily. Because all are automation, they cross checking it was correct or wrong. If any missed, they are adding. Their work was easy. So reduce the manpower and increase the number of charts coded per day. Then increase the accuracy. Quality also automatically increase, because if it was suggested 80 to 90% correctly, for the remaining 10-20% we can cross check easily. Rather than coding 100%, already you get 80% of the codes. For remaining codes, we can check easily, right? So increase the productivity and accuracy, quality, and reduce the manpower. These are the impacts on implementation of CAC. These are the impacts on coder. Next, guys. If CAC software suggested unspecified diagnosis, document have more specificity, how we will follow? As per the documentation or as per the CAC suggested code?
For the documentation.
As per the documentation, okay? We need to go with as per the documentation. We should not code directly auto suggested codes. We need to go with as per the documentation, whether it was correct or wrong. If it should be correct, we need to accept. If any more specified code documented in the record, we need to go with more specified code. Suppose a CAC software suggested neuropathy. In the past medical history, have diabetes. How we need to code generally?
Combination codes.
We need to go with combination of diabetes neuropathy. It was not, but it was not combined. It was taken only neuropathy. Okay. We need to go with more specific diabetic neuropathy code. We need to reject the neuropathy unspecified. Rather than unspecified, as per the documentation, we need to go with more specific code. Clear?
Yes, sir.
Next thing. Note down CAC software questions. What type of questions you will get from the CAC software? No? First question, which tool used in the CAC software? Which software tool they are using?
NLP.
NLP uses natural language processing. NLP software. Lot of people who are working, they have idea in CAC software. You will get 3M in the 3M software already codes, right? Anybody working in the CAC software?
Yes, sir.
You are getting all the 3M codes, right?
Yes.
Procedures,
Yes.
diagnosis. You are just cross-checking whether it was correct or not. NLP software tool was using. One question you will get from this tool. And another question, you will get how it was impact on the coder. And another question, CAC suggested unspecified diagnosis, document have more specificity, how we will code. These three questions you will get from the CAC. Are you able to answer it?
Yes.
Yes, no, it was not that much
Can you
difficult.
repeat the questions, please?
How the CAC software impact on the medical coder? Okay, how it will be impact on the medical coder? Reduce, increase the number of charts coded per day and reduce the manpower. What language used in the CAC software? NLP. Language should be NLP. CAC suggested unspecified diagnosis, but document have more specificity. How we will code? We need to go with as per the highest level of specificity. Okay, that's it for CAC software. Next softwares, encoding software. Encoding software. Anybody have idea about encoding? Anybody have idea encoding? Anybody using encoder software to lead the codes?
Yes, sir.
So what is the encoding? Encoder.
Encoder Pro.
Yeah. Tell me how it will work. What is the
It's
user
just
of
like
encoder?
It is a software which helps us find the ICDs and CPTs just like the book via the index
That's it.
and lookup terms.
Encoding was a coding software. Okay. How we are leading the codes in the book, ICD, CPT, or PCS. Same, the software also have index and tabular list, and it was keyword wise. Okay, keyword wise it will work like how we are using the books. Instead of book, while you are working, you will get the software to lead the codes. In that, encoder as one of the software to lead the medical codes. That's it. There is no more concept about encoding. Encoding was a coding software. It was used for the leading of medical codes, either CPT, ICD, or PCS. Index wise, tabular list wise, or keyword search wise. If you enter the code, you will get the description. If you enter the diagnosis name, you will get the code. Or if you know the keywords, 3-4 digit of the codes, if you enter remaining codes, it will suggest. Clear? Next, grouper software. Grouper software. So grouper was the software already coded data. It will analyze. Okay, it will analyze already coded data and it will suggest reimbursement process. Okay, It was used for the calculation of reimbursement, either DRG or APC. So encoder like code book, alphabetic index or keyword search and code validation used. Grouper software, it was analyzes for the calculation of reimbursement. Calculates DRG groups based on the PDX, SDX and POA DRG factors. We have some DRG factors now. Based on this, all it will calculate the DRG. Okay. And applies complex logic to payment methodology for payment purpose. The grouper software used for the calculation of payment methodologies, either DRG or APC. APC calculation and HEC we don't get. We don't have syllabus in the HEC related. So HEC used for the HEC coding, risk adjustment. APC calculation for outpatient, DRG for inpatient, HEC for HEC coding. Okay, risk adjustment, but in our syllabus we have DRG and APC. So DRG for inpatient, APC for the outpatient. Based on these calculations, how it will be calculated now by using the grouper software, they will calculate the APC payments and DRG payments based on the respective guidelines. Okay, used for the calculation of payments. These three software related, you will get questions. DRG, sorry, CAC should be auto-assisted coding. Encoding should be the codes leading software. Grouper software for the payments calculation, and DRG and APC based. And it will analyze the coded data and it will give the payment methodologies based on the DRG and APC. Which payment methodology you apply? DRG means it will calculate the DRG value. APC means it will calculate the APC payment. These are the softwares: encoding, grouper and CAC. Clear? Next, note down some important concept. Timeline standards to complete the document. In this concept, we will get 2 to 3 questions. So, is there limit to complete the documentation? Okay. Each document have certain limit. Within the time limit, we need to must complete the document. Okay. Sometimes we can't able to complete. Suppose if you are getting any conflict or incomplete documentation, definitely we should not able to complete on the timeline. Normally, we need to follow the timeline standard for every document. Okay. Every record must be completed within 30 days after discharge. Within 30 days after discharge, we need to complete. Every document must complete within 30 days after discharge. First concept note down. You will get the question, patient admitted in the emergency department and discharged from the emergency department. Within how many days we need to must complete the document? Within how many days we must complete?
30 days post discharge.
30 days. Records must be completed within 30 days of discharge. Okay. Compulsory you need to complete within 30 days. Next documents note down. These all are note down timeline standards. History and physical examination within 24 hours after admission of the hospital. Prior to admission, 30 days. Before admission, 30 days. After admission, 24 hours. We need to complete the history and physical examination. Operative notes immediately after the surgery. Discharge summary within 30 days of discharge. Progress notes contemporaneous with care means continuous with care. Consultation reports within 24 hours to 48 hours. These are the timeline standards to complete the document. From you will get one question from the history and physical examination, guys. How many hours we need to submit the history and physical examination after admission in the hospital? You will get option like 24 hours, 48 hours, 72 hours, 30 days. Within 24 hours, we must submit the HNP. Noted. From HNP one question, and what is the time frame to complete the record one question you will get from the timeline standards. One question you will get from this concept.
Sir, HNPM?
Total document. Okay. Record must be completed within how many days after discharge?
Okay.
30 days, no? This question. From this, you will get record must be completed within 30 days of discharge. On that concept one question. They will give question, patient admitted in the emergency department and discharged from ED within how many days you will come. Clear? Timeline standards.
Yes, sir.
Yes, sir.
Yeah, thank you. Next concept. CAC completed, no? So, next, tomorrow onwards, we can start the discussion of multiple choice questions, explanation and complaints, vice versa, guys. Because in the paper also 70 to 80% of the questions related to multiple choice questions related to complaints. And the question wise, I will explain the concept directly, okay? So I will share the paper with you by tomorrow morning. Take the printout and start the preparation for exam. If you read the paper thoroughly, you can pass easily exam. Okay.
Okay, sure, sir. Okay, sir.
So tomorrow onwards, do not miss the sessions maximum. And I will start the recording again from tomorrow, and I will give the paper explanation and this multiple choice questions first and complaints vice versa. Okay. And who need ICD classes for fast track, I will give the next week. Okay, 2-3 sessions I will conduct, updates, book related and important concepts. Next week I will complete, and again we can start the case studies. Okay, for multiple choice questions no need ICD. For case studies you need ICD. So I will take two to three sessions, Monday, Tuesday or Wednesday, then Thursday, Friday, Saturday I will complete your syllabus by June 6th maximum. This next 3 days I will complete the multiple choice. Thursday, Friday, Saturday. Okay.
సార్ నిన్నటి క్లాస్ రికార్డింగ్ గ్రూప్ లో పెట్టలేదు సార్.
నేను అదే చెప్పాను కదండి, ఆల్రెడీ రికార్డింగ్స్ అన్ని సెండ్ చేశాను, క్వైరీస్ రిలేటెడ్ మీకు చూసుకోండి, డైలీ రికార్డ్ చేయను అని. ఆల్రెడీ 3 classes I given క్వైరీస్ రికార్డింగ్ అండ్ కంప్లైంట్స్ రికార్డింగ్స్ కూడా ఇచ్చాను, చదువుకోండి థియరీ అనేసి, మీకు టైం ఉన్నప్పుడల్లా వినండి చదువుకోండి అనేసి నేను అన్ని ఇచ్చేసాను మీకు ఆల్రెడీ రికార్డింగ్స్. క్వైరీస్ కిందే ఇచ్చాను చూడండి, వాచ్ దిస్ వీడియోస్ ఫర్ క్వైరీస్ అనేసి. మీకు అన్ని పంపించేసాను, చూసుకోండి. Again, if you need, I will send queries related. Okay. One more time, I will send. Go through these videos, guys. If any confusion, and I will give the PCS mark exam. Do it. It was a 75 questions. I am sharing again queries related videos. Watch these 3 videos for queries.
సార్ ఈరోజు పీసీఎస్ మార్క్ ఎగ్జామ్ సెండ్ చేస్తారా సార్?
ఇప్పుడు సెండ్ చేస్తానండి బికాస్ ఆల్ ద PCS కాన్సెప్ట్స్ కంప్లీటెడ్ నా. Now I will send, it should be 75 questions. Do it whenever you have time. I will send now itself. You can do that mock exam also, guys. It will take 2 hours minimum. Here you will get ICD, PCS, complaints, not complaints, provider queries and POA concept related, CCMCC, all the things. Not only PCS coding, provider queries, CCMCC, PSI, HSC, this all the things you will get. Okay. Clear?
Yes.
Okay, guys. Thank you. Then we can connect tomorrow again.
Thank you, sir.